Hello and welcome to the Misty Blue Days of Our Lives podcast. I'm your host, Misty Blue from MistyBlueDream.com. That's MistiBlueDream.com. And I'm here to talk about a little bit of everything. Thanks for tuning in. As a disclaimer, nothing said here on this podcast should be used in place of medical or professional advice, as the intent of the content is to share personal information, opinions, and thoughts. This is episode number 6, and today we will be discussing Ehlers-Danlos Syndrome. So I'm going to read a paper. I actually wrote it for my biology class, which was, we had to choose an inherited genetic disorder. And of course I chose Ehlers-Danlos Syndrome. The reason why I chose it was because I have Ehlers-Danlos Syndrome. Today I'm actually 35, or as I record this, is my birthday. And I just actually, about 2 years ago, became aware of what Ehlers-Danlos Syndrome was. I did some research. I was, basically a textbook case. And it was very apparent, very obvious that I had Ehlers-Danlos Syndrome. I had doctors agree with me, but they weren't very familiar. So I didn't actually get my official geneticist diagnosis until actually just last week. I was able to see Dr. Atwal in Jacksonville, who was previously at the Mayo Clinic, and that was a really informative, great appointment. And we're actually going to be doing more testing because he feels that I have also some type of heart disorder as well. So I'm doing a full genome or exome or whatever you call it, to get more information. So, on the Baton scale, I was 9 out of 9, which I'll be going over all of that with you. And all of the hypermobility was just very obvious and apparent, as well as my history, family history. I well over exceeded the criteria for that. So I'll go ahead and just start reading. And after that, I will discuss a little bit more and some more personal details and information as well. Ehlers-Danlos Syndrome is an inherited heterogeneous group of 13 subtypes in which abnormal collagen synthesis affects connective tissue, skin, bones, ligaments, blood vessels, organs, and tissue. Collagen is a major structural component of the body. Danish dermatologist Edvard Ehlers recognized the condition in 1901. In 1908, a French physician named Henri Alexandre Danlos suggested the features of the syndrome. Weak and structurally abnormal collagen may result in flexible and loose joints, poor wound healing, fragile blood vessels, ruptured or prolapsed organs, dysautonomia, and many other various health conditions. The inheritance pattern vary based on each subtypes. And then at this point, I kind of discussed the COL1A2 gene, which there are multiple genes that go with multiple subtypes, besides the HEDS, which is the hypermobile EDS, the most common one, which is about 1 in 3,000 people who have it. That one does not have a gene associated with it at the moment. But that is actually in the works. However, recent testing and research has been launched to discover the gene associated with HEDS. The launch collaborated with Ehlers-Danlos Society will collect enough data to gain more knowledge of this rarely diagnosed disorder. Different genes are associated with different subtypes, and symptoms can range from mild to life-threatening. For formal diagnosis, a referral to a geneticist is a start. There is a test called the Baton scale, which helps assess hypermobility since 1998. Medical history is also important for diagnosis. There is a list of diagnosis criteria for each subtype that require a patient to meet a certain amount of history and symptoms. Vascular EDS can be potentially fatal, which makes proper diagnosis and subtype classification important. Ehlers-Danlos syndrome is not curable, but symptoms may be managed with a team of specialists. It is a systemic disorder, meaning that multiple systems may be affected. Many patients see a range of specialists such as pulmonology, electrophysiology, cardiology, gastroenterology, neurology, pain management, and so on. Specialists involved depend on the patient's specific symptomatic issues that are a result of the connective tissue disorder. The current statistics for the more common subtypes are 1 in 2,500 to 1 in 5,000. There are some rarer types that only have a handful of documented cases. However, recent clinical studies show that EDS is more common and not so much rare as it is rarely diagnosed. This makes awareness, education, and advocacy so important in order to better understand and diagnose the disorder. So, that's part of why I am so passionate about awareness, advocacy, education, is because, again, I'm 35 today. 2 years ago is when I discovered Ehlers-Danlos Syndrome, so I was 33. I've spent my whole life having chronic health issues with no answer. And, the reason why it's important is because those 33 years of my life were hell. And because I didn't have an official diagnosis, there are a lot of times where I was medically neglected or completely dismissed. And I'm not the only one who can say that. There are many, many, many patients out there that are not getting the help or the treatment that they need because they're not understood by their doctors. And so that's why this is so important. Another common thing with Ehlers-Danlos syndrome is they have dislocations and subluxations. So I want to explain the difference of the two. A dislocation is defined as displacement of a bone from its natural, my wording's all messed up. Let me start over. A dislocation is defined as displacement of a bone from its natural position in the joint. A subluxation is basically defined as a partial dislocation. So kind of like it'll slide away from, but not fully dislocating. A lot of people get the two disconnect or mixed up, and they'll think that they have dislocations, but really it's a partial dislocation, like a subluxation. For me personally, I don't get full dislocations. I do get subluxation, so my shoulder will completely sublux, as well as my hips, and sometimes my rib, depending on if I'm in a certain position or cough or whatever. And so that can be really uncomfortable. So if you think about it, over time, you get a lot of wear and tear on your ligaments. This is something that is associated with chronic pain. There are a lot of there's basically, if you visualize an umbrella, and the umbrella is Ehlers-Danlos syndrome, and everything that is associated with it falls underneath that umbrella. So that's also why things can get hazy and confusing, because say you don't have that official diagnosis yet, but you have all these things under the umbrella of this mystery. It can be very confusing because people will focus on one thing, or you'll have so many diagnoses that a lot of times people will even get be called a hypochondriac, which I definitely had dealt with that, and I have been in that position where I've had people in my life who accuse me of being a hypochondriac, or that I complain a lot, or there's always something wrong with me. And it's really disheartening, because especially if it's a loved one or someone you care about, because here you have these pretty awful health issues, ailments, and things going on that can be kind of scary. And then it makes you feel just isolated, because the people that you love and trust, or even doctors, just aren't on your side and they don't understand. So there are, underneath that umbrella, there are some more common issues of Ehlers-Danlos syndrome. So I would say one of the more common ones is just different forms of dysautonomia. Dysautonomia is the dysfunction of the autonomic nervous system. which also in that category on its own has different things under that umbrella. So the more common one for EDS is Postural Orthostatic Tachycardia Syndrome, short for POTS. They say that about 80% of people with EDS have POTS, but it's not the other way around. So a lot of people have POTS. It's actually fairly common. A lot of people with autoimmune disorders or other issues going on, Lyme disease, for example, will have POTS, but that doesn't necessarily mean that they have EDS. So it doesn't go both ways. There are a lot of neurological issues that come along with POTS, and so technically, if you have POTS or dysautonomia, you have brain fog, which you always see a good example of me when I'm speaking in my podcast. I'll totally have a brain fog moment. With POTS, you also have episodes of tachycardia. Obviously, that's in the name. Tachycardia is a fast heartbeat. Basically, what happens is when you're sitting down, your heart rate might be 70 beats per minute. And then when you stand up, it suddenly jumps 30 or more beats per minute, which, you go from sitting at 70 beats per minute, you stand and you're at 100 beats per minute. That's an example of POTS. What happens is typically in most cases of POTS, your blood pressure drops when you stand, which is where, the postural orthostatic comes in. And then you get the tachycardia, which is the fast heartbeat, because that's compensating for the low blood pressure. And the reason why it's a syndrome is because that syndromes usually are associated with, again, that's the umbrella effect, multiple issues. So a lot of symptoms with POTS, you have headaches, nausea, brain fog, there's so many. There's just basically a general feeling of just not feeling well. And I honestly think a lot of people who are not diagnosed might feel like they're having anxiety attacks, and they might possibly be having episodes of POTS, because it does also feel like an anxiety attack. So that's one of the common things under the umbrella. Another common one is mast cell, which is it can contribute to POTS. So you can have episodes of POTS because you have low blood volume, or you could also have episodes because they're triggered by mast cell. So mast cell, let's see if I can actually pull up a better definition of what I'm going to give you. The reason why, well, for me, I'm not as familiar with mast cell because, in the community, I see a lot of people have mast cell. They have the rashes and they break out in hives. They get anaphylactic. They're in the hospital. I've never had that, so I kind of just assumed I didn't have it. But when I talked to the geneticist, he diagnosed mast cell, and he said that it's actually more uncommon for people to have the anaphylactic response and the hives, and to have those more visible things that you can see that you're expressing having an attack. So he said it's actually a little more common to not see those, but have the reactions like you do with POTS or tachycardia or these episodes of fatigue. So mast cell activation syndrome is one type of mast cell activation disorder, and it's an immunological condition in which mast cells inappropriately and excessively release chemical mediators, resulting in a range of chronic symptoms, including anaphylactic or near anaphylactic attacks. So that's exactly what I was saying about. That's kind of why I dismissed it, because that's more of an extreme reaction. So basically, for me personally, when I have the episodes, I have so many sensitivities to chemicals, different foods, and so I have to have like a really strict diet. I have to be careful what I'm exposed to, otherwise I can get very sick very fast. So for me, I get a lot of lung issues, like I'll get bronchitis easily. I get a lot of sinus issues, sinus infections, stomach issues. All of these are kind of results of what varying on based on what I'm exposed to. So at the end of the day, you know, what you kind of have to keep all of these things under control separately. So, you know, for POTS, I try to make sure I stay hydrated. I usually use like banana bag oral solution, or I go in and get IV fluids at least once a week, and that kind of keeps my blood volume nice and plump. I eat a lot of salt, and that keeps my blood pressure up because I tend to be low. The geneticist actually said that I should start taking salt tablets because eating salt in my diet isn't enough. He said if I were to eat as much as I need to have, my food would be inedible, which makes sense. And so that's something I'm going to start here soon, because I guess I'm still not getting enough salt despite having it so heavily incorporated into my diet. Another thing with POTS, you know, to help with that is wearing compression socks that kind of helps compress everything and tighten everything up, so that way, you know, the blood flow is a little bit better with the circulation. It kind of pushes the blood where it needs to be, if that makes sense. So, and then with Mast Cell, again, I'm new with this, but the geneticist, he said taking Zyrtec every day would kind of help keep those episodes reduced, so that if I am exposed, I don't go into these episodes. So basically with my episodes, what happens is if I am exposed to something, you know, usually at nighttime, like after I had dinner or something while I'm laying down, I will get these attacks where, again, typically my blood pressure is very low. It sits at around 100/50 on average. And what happens is I get these like full body rushes where I feel warm. My left arm starts to hurt. I get a little bit of chest pain. Sometimes I'll get palpitations. Almost feels like I'm about to have like a heart attack or something, which is scary. But you know, it's what's hard and is that if I were to go to the ER every single time I felt that way, I would live there. So it's really hard to kind of figure out what I should truly be concerned about versus, you know, just trying to manage it. So anyway, I started having these episodes, and then just like that, my heart rate will shoot up, and I'll be lying down resting, having a great day. It's not stress related. I'm just relaxing, maybe trying to get to sleep even. And then my blood pressure will shoot up as well. I'll get uncomfortable feeling in my stomach, and then I'll have like this weird head rush where I'll also get tingling in my face. And so with these attacks, I'm hoping that, you know, keeping my fluids where they need to be, and then introducing the Zyrtec and these other ways to manage it, that I can hopefully reduce these episodes, because there are times when they get bad like that. I do have to go to the ER just to get everything under control, because if you don't know me personally, this is more of a separate thing from EDS, that I also have an extensive cardiac history. I've had 4 cardiac ablations. I have WPW, which is an extra pathway in my heart that produces arrhythmias. I have a pacemaker. I have had open heart surgery for my aortic valve, basically kind of tearing or having a hole in it that they had to repair. We're monitoring that. I'm going to have to get that valve replaced. So I'm actually going to the Mayo Clinic for my 6-month checkup to see if that, as well as my aortic dilation, if that's gotten worse. Which is why my geneticist wants to also test for something else, because he said, you know, it's very possible that you can have Ehlers-Danlos Syndrome and another thing. You know, another issue for some people is that when they have a diagnosis, that's it. That's the one they are with forever. That's when the doctors focus on. They don't realize there might be other things going on. And so it's kind of nice to get to the bottom of it, which helps with how to properly get these things managed, as well as, you know, having kids and knowing if it's hereditary, if it's a possibility that they could have them as well. So what else? I would say a lot of other manifestations with Ehlers-Danlos syndrome would be chronic fatigue. So, basically our bodies are just constantly fighting, worn out, easily and we get easily deconditioned. I wish I had a better way to describe it. I guess so say you're in the ocean and you have like a healthy person would be in like a motorized boat that has gas and they're able to move around. And I would say someone with Ehlers-Danlos syndrome, like their life would be like they're on a raft trying to get to where they need to with, their own manpower, and it's exhausting and just constantly trying to stay afloat. So in a nutshell, that's sort of how it feels like having Ehlers-Danlos syndrome, because like I said, it is just absolutely exhausting. And just what it feels like for me many days is that it's just like every cell in my body is exhausted. So one of the other things that was recommended by my geneticist, which fortunately I'm already on top of, is physical therapy. So getting physical therapy helps because, the specific one that I'm doing, a lot of times people have specific therapies for like maybe they have an issue in their knee or in their shoulder that they really need to work on, focus on. But for me, I'm doing basically like a generalized deconditioning physical therapy, which is supposed to help with pain and just energy levels, because again, people with Ehlers-Danlos syndrome, they get easily deconditioned. And so I haven't started that yet, so I'll have to get back to you on that, how that's going. But I'm really looking forward to it because I'm hoping it'll help my quality of life a little bit, because I'm just so exhausted all the time and I'm constantly in pain. When I wake up, it's not like you wake up and you stretch and yawn and the birds are singing. I wake up, I roll over and things start popping back into place, and I'm dizzy, I'm nauseous, I'm in pain, I'm thirsty. I feel like I just fought a war or something. I don't really know how to explain it, and I never feel rested. And so even at nighttime, as soon as I lay down, like I get full body spasms. And what can be frustrating is that a lot of people, when you explain that, it's like the first thing they think of is like, oh, well, maybe your magnesium's low, maybe your potassium's low, your electrolytes. But typically when I have my blood work, because I eat so healthy and take supplements, that's not the case. My potassium and magnesium levels are great. My blood work's actually pretty beautiful. I've worked very hard. I'm very proud to say that. And that's just kind of an example of the invisible illness. It really truly is, because you look at me and, even with my blood work, that these things don't show up. And so that's what's also really hard about trying to be taken seriously. So it's really important to have a knowledgeable team. So if you are seeing a doctor and they don't know about it, then you need to just go even outside of the area. I actually just wrote a blog recently called "Why I'm Leaving the State to See a Doctor," or "Why I'm Going Out of State to See a Doctor." And the reason why is because the great example of this is seeing my neurologist. So I have a lot of neurological issues, obviously, the full body muscle spasms, the tingling in my hand. I have many issues, and dysautonomia is also included in that. It's not necessarily a cardiac issue, it's a neurological issue. And so that specifically kind of gets bounced back and forth. The cardiologist is like, no, see the neurologist. The neurologist is like, oh no, see the cardiologist. And really, like, it's kind of in this gray area where not often everyone wants to deal with it because they just honestly don't know how. So when you have a complex issue, sometimes you do have to consider going out of state because, you know, I'm going to be going to an autonomic dysfunction clinic at Vanderbilt. I'm either going to go there. I still haven't got my appointment booked. If that doesn't work out, I do have an appointment in the works for a place in Phoenix that specializes in complex neurology and EDS. So of those, you know, there are 3 of those in the country. And, you know, what's difficult is my current neurologist here locally, he's not familiar. And so he keeps trying to push the idea that I'm having seizures. He's wanting me to take the meds. He just did another EEG on me, a second one in 2 years. And I'm not convinced I'm having seizures because I'm very familiar with this. And I would be actually shocked if that's the case. I think he just doesn't know how to handle autonomic dysfunction. And so because he specializes in seizures and that makes sense to him, I think it makes him, you know, feel like he can be treating me and helping me by, you know, doing what he knows, and which is whatever. But that's why it's important to be your own advocate, because I know that that's not the case. My electrophysiologist, he's very familiar with it. He understands. And so at least I have him to be able to kind of reference back to him if I'm in the ER and have an issue. Because a lot of times when I do go into the ER, that's the other thing too, is they're not used to complex patients. So when they see someone who has this high heart rate, high blood pressure, who's shaking, I mean, frankly, it looks like an anxiety attack. And they look at me and they ask me if I'm stressed. They don't really know what to do, but really my body is in crisis mode. So it's great to be able to say, hey, call my doctor, my electrophysiologist, here's his card, here's number, you know, and so that way they can properly treat me, which we have a protocol that we do that is able to get me out of these horrible crisis modes. So, and again, for Ehlers-Danlos Syndrome, there are just so many different things that go along with it. And I'll probably do another podcast similar to this. So I'm going to wrap it up now because I'm going to get my children from school. But again, I would love to do a couple more episodes on Ehlers-Danlos Syndrome. So maybe I will interview other patients that I know that are as knowledgeable. Maybe they could share their experiences. And at the end of the day, like I said, you know, the best thing we can do is continue awareness, education, and advocacy, because that's what we need in order to be seen, to be heard, to be treated properly, to understand our illness. Because unfortunately, with a complex chronic illness like this, we really do have to be very educated on how to take care of ourselves. So that will be all for now. And you can go to my website at mistibluDream.com. And if you want to be on the show, let me know. Please subscribe, leave me 5 stars so that way people can find me. And I'm also on Instagram at mistibluday.com. If anyone ever wants to talk or has any questions, I'm always here. I'm always available. I'm always down to help. So yeah, that's it for now. Have a good day.